Hi, I'm Dr. Brian Thornburg, and there's a 2022 article that I want to bring to your attention. The title of the article is Antibiotic Exposure and Adverse Long-Term Health Outcomes in Children, a Systemic Review and Meta-Analysis. This was published in the Journal of Infection, and the results are startling. And I want to review these with you so you can understand that antibiotics should not casually be taken. And unfortunately, most physicians, most pediatricians are handing out antibiotics when they should not be for many different reasons. One, because there's not time in the practice to allow proper follow-up and wait to see if the child actually needs them. The parents don't want to have to come back to the waiting room and sit there for an hour or two just to get the antibiotic because it wasn't provided the first time. There could be parental pressure, almost demanding that an antibiotic be started. But hopefully after you hear this, you'll have a little bit more temperance when you decide to reach for that antibiotic or think that's an appropriate first step. And I do want to highlight that the majority of pediatricians do not follow the recommendations from the American Academy of Pediatrics that states unless you see a bulging eardrum with pus behind it, you should wait and not provide an antibiotic. You should wait and see if an ear infection is going to develop that requires an antibiotic. Unfortunately, I think about 80% of physicians, pediatricians are not following those guidelines. And that is unfortunate, especially once you start seeing what I'm about to present. So there were 160 observational studies gathered, and there were 21 different health outcomes that were analyzed. This study looked at over 160 observational studies, included 21 health outcomes, and included more than 22 million children. So these are the health outcomes that were worsened because of taking an antibiotic. Eczema, allergic symptoms, food allergies, allergic rhinoconjunctivitis, wheezing, asthma, increased weight gain or being overweight, obesity, juvenile idiopathic arthritis, psoriasis, autism spectrum disorder, neurodevelopmental disorders such as ADHD or learning problems, allergic sensitization, infantile colic, inflammatory bowel disease, celiac disease, type 1 diabetes, and independently attention deficit hyperactivity disorder. I want to note that just taking one course of an antibiotic does not increase your child's chances of developing one of these health outcomes. However, starting at 2 antibiotic courses or more does increase the chance of your child developing one of these negative health outcomes. Additionally, it was found that most of the antibiotics, whether it's penicillin, tetracycline, macrolides, all of them contributed to these negative health outcomes. So how do we resolve this going forward? Because we can't change what has already happened, but they do get sick and sometimes they need antibiotics. We have to learn for the appropriate signs that would warrant an antibiotic. You also want to have a very good relationship with your pediatrician so you can have honest discussions. Ask the question straight out. Is this a possible viral illness that doesn't warrant an antibiotic? Can I just do a wait and see and you hand me a paper prescription for the antibiotic, but we'll see where the child goes over the next day or two? What are the endpoints that I should look to say, I've waited long enough and now I should treat my child with the antibiotic? On the flip side, if you do start the antibiotic, we want to make sure that we're giving adequate and good probiotics. I tell all of my patients to take at least 25 to 50 billion CFUs of probiotics at least 2 hours before or after the antibiotic to help the gut repair itself right away. Also, we want to make sure that we're starting high-dose vitamin D at the first sign of an illness. Vitamin D supports boosting the immune system, and the white cells in our body, the fighting cells in our body, have vitamin D receptors. So when you do high-dose vitamin D, again, look at my video because I give the dosing there. What this will do is reduce the severity of the symptoms in most cases and will also shorten the duration of the illness in most cases. So there are alternatives to just running right to an antibiotic. So make sure that you are practicing the best medicine you can for your kids, and thanks a lot for watching.